Welcome, class, to the Week 5 presentation for ME105 Medical Terminology. This week we have some new content to focus on, but I also have to prepare you for your midterm exam. So do remember, for your midterm, you are going to have to review all the previous content from week 1 all the way to what we cover today before you take that midterm exam. It's very important. We'll talk about that more when we get to the end of the presentation. For this week, the new information that you need to get in your brain centers around Chapter 10 as well as Chapter 11. Chapter 10, we're focusing on the respiratory system, and Chapter 11 focuses on the digestive system. Two pretty heavy hitters, so make sure you read through those chapters thoroughly. We're going to start with the respiratory system, and here you can see the structures. It's important to know and understand the flow of air in anatomical order. So we take air in, we go to the trachea, to the bronchi. Those bronchi divide down into the bronchioles, and then we get to the alveoli, which are in fact the air sacs where the exchange of oxygen takes place. In terms of our lungs, it's important to remember that they are protected by a pleura. The pleura is that protective double-layered membrane that forms a sac for each lung. That pleural then folds to form the pleural cavity, which we've talked about way back in week 1. The alveoli, these are located on the ends of the bronchi, actually on the ends of the bronchioles. They look like those little grape clusters that we see in that magnified section. They are surrounded by capillaries. They are very thin-walled, and the purpose of that thin wall is to allow for the passage of oxygen. One term I want you to be familiar with is phrenic, and it is spelled Phreenic. That term means that it's pertaining to the diaphragm. The diaphragm does play an important role in terms of our respiratory function. Looking next at the function of respiration. So respiration has two components, ventilation as well as the exchange of gases. So ventilation is the movement of air and its gases into, which is inspiration, and out of, which is expiration, the lungs. So inspiration plus expiration equals that ventilation. The exchange of gases occurs between the air and the blood, and between the blood and the interstitial fluids. There are several functions to our respiratory system, the first of which is the exchange of gases. All the body cells need oxygen, and they also produce carbon dioxide. The respiratory system allows oxygen from the air to enter the blood and carbon dioxide to leave the blood and enter the air. Another function of the respiratory system is the regulation of blood pH. The regulation occurs by changing blood carbon dioxide levels. The third function of the respiratory system is protection. The respiratory system protects against foreign bodies and against some microorganisms. The fourth function is voice production. Often we forget about that, but the movement of air across the vocal cords makes voice production and sound possible. The fifth function is olfaction, which is smelling. There are 12 million receptor cells for smell, and they are in a patch of epithelium in the extreme upper region of the nasal cavity. Hence, that's why we need to sniff up air in there to smell. For comparative sake, a dog has 4 billion receptor cells, which is why dogs can be trained to sniff for drugs and explosives. Looking more in depth, inhalation is the same as inspiration. Exhalation is the same as expiration. When we have inspiration plus expiration, that equals that respiration. So a normal adult respiratory rate is between 10 to 15 times per minute. During inspiration, the diaphragm moves up and the muscles of the ribs move up and out, enlarging the thoracic cavity. The enlargement reduces pressure in the airways. The alveoli then inflate to equalize that pressure. During expiration, the muscles relax, reducing the size of the thoracic cavity back to its original size, and air is then forced out of the alveoli. Looking at patterns of respiration, there's a few terms that might be new to you. Bradypnea, the second one, that's a slower than normal. breaths per minute. Tachypnea, that would be a faster than normal breaths per minute. Hyperpnea, that's deep breathing but faster. So excessive ventilation, such as hyperpnea, can lead to hyperventilation, which is an increased aeration of the lungs, which reduces carbon dioxide levels in the body, but it can disrupt homeostasis. A ventilator. This is a machine that breathes for patients who are unable to breathe on their own. This machine is generally used for the prolonged artificial respiration. And then we have some respiratory conditions I want you to be aware of. The first one is pneumothorax. That is air in the chest, and it may result in a collapsed lung if it's not handled. SIDS, sudden infant death syndrome. This is an unexpected or unexplained death of an infant. Usually they find that there could be a link between sleep apnea, airway spasms, and the failure of the nerves to stimulate the diaphragm. COPD stands for chronic obstructive pulmonary disease. This is a chronic, progressive, and irreversible condition. Airflow to and from the lungs is decreased. Crackles. That's a crackling sound that sometimes the lungs can make. Infant respiratory distress syndrome. This is seen in premature infants whose lungs may not have fully developed. The lungs are not capable of expanding to their full size. Some other conditions to know that I want you to associate with long-term smoking, because your quiz focuses on that. Emphysema and bronchogenic carcinoma. So emphysema. This is the destruction of the alveolar wall, leading to overinflation of the alveoli, so it's like trapped air. Bronchogenic carcinoma, this is a malignant or cancerous lung tumor that originates in the bronchi. There's one therapeutic procedure that your quiz focuses on, and that's postural drainage. This is positioning your patient in a way that uses gravity to encourage the removal of secretions from the bronchi. And here in the slide, we can see pictures of the patient being moved different ways and which region of the lung could be drained from that movement. One medication to remember, bronchodilator. So a bronchodilator does just what its name indicates. It dilates the bronchi. And by dilating it, we are widening it to increase that airflow. Next, we're going to move forward to our digestive system. Here we can see the word roots that are often associated with our digestive system. Those are very important when you're looking at breaking down the terminology of the digestive system. The term alimentary means pertaining to the digestive tract as a whole. Some structures that we see in the alimentary canal are the mouth, the pharynx, the esophagus, the stomach, the small intestines, and the large intestines. There's also some accessory organs of digestion that are important. The teeth, the tongue, the salivary glands, the liver, the gallbladder, and the pancreas. We are going to look at the stomach. There are various areas to your stomach, and they are labeled on the diagram here. The fundus body and the antrum are along the antrum, and the pylorus kind of go hand in hand. Those are the major divisions of the stomach. The rugae are those gastric folds that we see inside the stomach. The pyloric sphincter is the sphincter between where the stomach ends and the duodenum of the small intestines begins. And the pylorus is that small part that connects to the duodenum. Going right into our small intestines next. So we have the duodenum, the jejunum, and the ileum. The duodenum is the first 9 to 10 inches of the small intestines. This is where pancreatic juices and also bile enter the small intestines. The jejunum comprises 40% of the small intestine length. It is the primary region for chemical digestion as well as absorption. The ileum, that makes up 55%, so that's the majority of the small intestines, and it's the area closest to the large bowel or the large intestines. There's one valve that separates the small intestines from the large intestines, and that's the ileocecal valve. Moving on to our large intestines. The large intestines happens to have 5 major functions: absorption of water and electrolytes, secretion of mucus to protect the lining of the intestines and to keep fecal matter intact, digestion of any remaining food product by bacteria in the large intestines, peristalsis, which is the movement of feces towards the anus, elimination of unused food product from the body. Here we can see the parts of the large intestines. The cecum has the variform appendix that hangs from it. From the cecum, we move to the ascending colon. We move across our abdomen through the transverse colon. We move down the descending colon, and we get to an S-shaped part known as the sigmoid colon, and then our rectum and anus. The accessory organs of digestion, these play a part in the breakdown of the chemical components of food. They are the liver, the gallbladder, and pancreas. And here you can see respectively how they lie in the body. There are 2 procedures I want you to remember for your quiz. Sigmoidoscopy. This is a diagnostic procedure, so it's not a treatment procedure, but it's a diagnostic procedure where they use a scope, actually go in through the anus and look specifically at the sigmoid portion of the colon. Gastric stapling. This is a surgical treatment for obesity in which they will make the stomach smaller so that less food can enter the stomach. And we have a few conditions to be familiar with for your quiz. Cirrhosis, that's a chronic liver disease that can cause jaundice. Choledoctolithasis, sounds like a mouthful, but basically it's the medical term for a stone in the common bile duct. Polyphagia is the term for excessive eating. Dysentery is acute. It's an acute condition of the intestinal tract that commonly causes pain, diarrhea, blood, and mucus in the stool, and it's caused by bacteria or a parasite. Let me go back before I move on to talk about the midterm. There's one bacteria that your quiz asks about, Helicobacter pylori. That is the bacteria that usually is responsible for gastric ulcers. So that is one I want you to remember for your quiz. Now we'll talk about your midterm exam before we wrap up the session. So your midterm exam is a heavy hitter, which means it's going to impact your grade more greatly than your normal quiz. What that means for you is you have this great opportunity to raise your grade, or you have this opportunity that if you don't prepare accordingly, it could really lower your grade. So do make sure you prepare accordingly to help it raise your grade. It's going to cover everything we've talked about from this week, the new information that I just talked about, as well as all the previous weeks. So make sure that you read through any notes you may have taken, that you refresh yourself with the chapters that we've already gone over. You can even re-listen to the lectures from those previous weeks. That would help you prepare as well. There are 50 questions on your midterm exam, so that means it might take you more time than your average quiz. Make sure you prepare accordingly and have enough time. It is worth 150 points. That's a lot, my friends. That's why I really want to make sure that you guys take the time to prepare. As always, if you have questions or concerns, don't hesitate to reach out to me. Email is the fastest and best way to get a hold of me. All the information presented today was from your textbook. Make sure you read the weekly chapters that were listed for week 5 in their entirety. That's chapter 10 as well as chapter 11. Thank you so much for your time this week and have a great week.